Hello, I'm Dr. Irqamed, faculty for your dermatology and cosmetology course. We all have this book with us. Today we will be talking about practical aspects of chemical peels, the procedure aspect and whatever is required for the display. You can go to the page number 52 of this book and whatever is mentioned over there is kept over here in front of you. First requirement is the place, the basic facility, the clinic, your room, a couch for the patient treatment, or it could be a chair also. Next, the most important part is the peel itself. This is an arginine peel, glycolic peel. Next come the reagents or the peels. We have 3 peels over here: glycolic peel, VC peel, arginine peel. Next we have to prepare the neutralizing solution, for which we take 200 to 250 ml of water, 1 teaspoon of soda bicarb. We mix it well with the water. Then we pour this solution into a spray bottle. Do remember to check your spray bottle beforehand so that there are no discrepancies during the peel. Be sure you prepare fresh neutralizing solution before every treatment. Next comes water, cold water, fresh cold water. A syringe filled with normal saline. If in case there is any spill to the eye area, we will use this. Gloves, cap or headband. Gloves for the treatment for the doctor and the therapist. Headband to cover the area on the head so that there are no hair on the face. Glass bowl for the peel. We will pour the peel as much as required in the bowl. We will use the brush with it. It is a different brush. It is a flat brush and a plastic brush. So we use it only for 6 to 7 peels. You can see the difference between the old brush and the new brush. It goes waste after 6 to 7 peels, so we shift to a new brush. We never keep the peeling agent in front of the patient. We only get the glass bowls and the brushes with us. All this has to be done backhand in your clinic. To prevent the sensitive areas from the peel on the face, we use earbuds and Vaseline around the nose area and corners of the lips. We use cotton pads for the eyes. We dip them in gulab jal, rose water. Though it is not mentioned in the book, but for the comfort of the patient, we definitely do a pack post peel. You can buy any pack available in the market, they are easily available. You will apply the pack with the pack brush. It is a different brush from the peel brush. A thin layer of the pack is to be applied on the affected area or the treated area. There is a difference between the two brushes. This is the pack brush and this is a peel brush. The peel brush is thinner than the pack brush. We leave the pack on the face for 10 to 15 minutes and then we wipe it out with water and absorbent tissue. One important instrument in the peel is for timer clock. We started the moment we start to touch the peel on the face of the patient so that we are able to maintain the time that is required for the peel. Now the peel is done and the patient is ready to go out. So we apply a liberal layer of sunscreen on the face. There might be slight irritation for some sensitive patients. In that case, we will apply a mild steroid cream first and then the dose of sunscreen. Most important things to remember: always prepare a fresh solution for the treatment. Cover the sensitive areas with Vaseline, that is the nose orifices and the corners of the lips. Never hesitate to apply the steroid solution wherever it is irritating.
Now we are going to start the peel procedure. First, we cover up the patient. Second, take the headband. and clean the face by cleanser. We have to remove all the dirt and oil from the face. When we clean the face, meanwhile we give the healthy massage for 5 to 7 minutes in circulation motion. So now we check the face is dry or wet. If the face is wet, we take some time for drying it. So meanwhile, we take a patch test on patient behind the ear like this, and a patch on jaw lines. This is for 1 to 2 minutes only. If we get some irritation, we will neutralize it. Otherwise, we are ready to do the peel on face. Do you have any problem, ma'am? Any irritation or burning sensation? You feel like that? Okay. We can start the peel procedure. So first we have start from the right forehead, and peel should be applied on the vertical motion. When we apply the peel in vertical motion, it's penetrate easily and give the patient good result. We are doing RG peel for skin rejuvenation. It can also apply on under eye and eyelid too, because RG is too soft peel and it not harass any part of body. This peel can you apply on lip too. After applying the peel, wait for 2 to 3 minutes. Any problem? Technician session. Now 3 minutes is over, so no irritation or burning sensation appearing here. So please clean the face with cold compressor of water. We take here cold water. Yeah, like that we have to just dab the face, not rub the face. Just dab, dab, dab over there. After clean the face, we apply the pack. It's showing still wet, so we wait for 1 or 2 minutes. soothing pack. स्लीप फोल्ड करिए. After applying the soothing pack, we have to wait till 15 minutes. Now the 15 minutes is over, so we are cleaning the face. After clean the face, we are going to apply sunscreen. It will take care about sun exposure and UV rays. After applying the sunscreen, the procedure is over and patient is ready to go.
Hello everyone. Hopefully you saw how we are using the peels, how we are applying the peels and what all is needed once you start your peel applications. What is needed in your clinic, what you should be expecting to start with. I want to introduce you today to our derma peels. We are using their peels. It is nothing commercial. It's not a commercial collaboration. It's just that I like their peels, and over the years I have realized that they are giving me the best results and they are economical also. So I asked them for their product monograph, and today I'll be sharing the product introduction with you.